Yeah, thank you.
What's his name?
Name?
Mr. John.
Mr.
Jones.
We just saw a monk with a monkey. His name was Mr. Jones. It was really exciting. A good first day sighting here in Thailand. So we wanted to talk about the broader reasons why we're here. What are we doing? We're doing a couple of things. One, Digital Democracy is launching a couple programs. We're launching handheld human rights to connect human rights workers around the Burma's borders using mobile phones. And we're launching Project Einstein, a digital pen pal program connecting refugee youth here and in the United States via photography. But we're also launching Digital Democracy TV. We created this internet TV show to explore the ways that technology is changing the world around us. Our first stop today is Bangkok Hospital.
I was going to get a bunch of shots before heading out to Thailand and realized that they were extremely expensive in New York. So decided to go the route of medical tourism. So there's a big healthcare debate going on right now, but the healthcare debate to an extent is sort of limited. I was working with some friends at Healthcare Now, and they're looking into the single payer option, which isn't really talked about. And there's groups like Hello Health in Brooklyn who cut costs by having online consultations instead of the office, which is really expensive. And then there's the international option, like going to a place like Thailand or Brazil to have work done at a fraction of the cost and supposedly at the same level. So let's go check out and see if it really is just as good for a fraction of the price. Primary language is English. So I could read the Thai. This is correct.
Correct, right? Very good. Okay, want to receive the vaccination, right?
Yes.
All right, perfect. Sit over there for a second, please.
Thank you.
So a year ago when we were traveling here, I got the Japanese encephalitis vaccine because I am very attracted to mosquitoes and it's a deadly virus. And I actually got this exact same sheet of paper from my travel doctor in Indianapolis, Indiana. I could have just come to Thailand and gotten it here.
And how much did that shot cost you?
Well, it was 3 rounds of shots and it cost, I believe, $180 each time.
And was that covered by your insurance?
No, it was not.
So far, so good.
Yeah. So far, so good. Correct.
I believe I need to get a tetanus shot. And I'm thinking about Japanese encephalitis, but looking for more information.
What you could do is do a combination vaccine that has both the A and B in one.
This is the most technologically advanced facility I've ever been to.
Thank you.
How is the medical system here structured?
Well, basically you have the government hospitals, private hospitals, and the government hospitals are overflowing. When you go private, you can sort of basically walk in and see whoever you want to see, as long as they have an appointment.
And how much of a difference in price is there between?
Depending on what happens to you. I just had an argument with my grandmother. I took her to a private hospital instead of her usual government hospital. And I said, Grandma, there are a lot of flu cases at that hospital right now. You're 86. I don't have that much time. You don't have that much time. It's worth it. They gave in and went to a private hospital. Finally.
And what was the verdict after?
So far, so good.
That's good. Alright, so I got tetanus in the left arm, and then hep in the right. Alright, so that sent me back about $110. And in the US, that would have cost at least 3 times as much for 3 shots. So made out pretty well.
The hospital here is really amazing. Everybody we encountered was super friendly, didn't seem to be overburdened by their work, seemed to be able to really extend that customer service, and everybody that we saw inside seemed to be getting great care, and that was certainly the case as far as you were concerned. On the next episode of DdTv, We meet with the tech community in Bangkok and explore innovation with social entrepreneurs.
Tap the keys to play.
Oh